as a quick reminder, this whole webinar series is a direct result of the topics that you as the board ranked last year after you identified areas that you wanted additional education and information on following the board self-assessment. So staff took that and created a year-long program that's a mix of face-to-face workshops like the one we did in January, and we have 4 webinars scheduled throughout the year as well. So one housekeeping note, this will be recorded for future reference, and the slides are available in share file. Since it's being recorded, please remember to mute your line unless you have a question, so that'll cut down on background noise for us. Today's session will focus on rheumatology research and training, the current landscape, as well as plans for the future. And our presenter is our very own Erin Marchiolo. Erin is our Senior Director of Research and Training, and I'm going to have her take it away from here.
Sure, thanks, Mary. Hi, everyone. Erin Marchiolo, and I'm really excited to get to spend some time with you guys tonight talking about rheumatology research and training. And as we go along tonight, please feel free at any time to stop me and ask any questions as they come up. So by now, all of you guys are pretty well versed in the priority areas of our new strategic plan that's going to take us from 2016 to 2020. So the purpose of tonight is to take a deeper dive into the workforce development and innovative research priorities in the plan. We're going to talk about data that supports the case for each of these priorities, and then also talk about what we're currently doing to address the need. My goal is not necessarily to do a comprehensive review of all the programmatic aspects, but really to address the why each of these priorities are important. So I want to start with a snapshot of the reality of rheumatic disease in the United States. So we know that over 7 million American adults suffer from inflammatory rheumatic disease, and nearly 300,000 American children suffer from rheumatic disease, the most common of which is JIA. The latest figures regarding rheumatic disease show that there's about $128 billion with a B financial impact associated with medical costs. And just to give everyone a little bit of a frame of reference, cancer care only leads to about $104 billion in medical costs. And then finally, rheumatologists and rheumatology health professionals have a really unique opportunity to impact the lives of patients in a positive way by decreasing pain and deformity, improving quality of life, and also preventing disability and even death. So this chart gives us an overall look at the prevalence of major musculoskeletal diseases, and I would note that the numbers in this might be a little on the conservative side. Overall, the population needing rheumatology services is projected to increase pretty dramatically, and that's based on a couple of things, but primarily due to both the aging of the population as well as just general population growth in the United States. And just to point out, as you can see at the bottom, the total cumulative impact of these disorders is impacting about 139 billion individuals in the United States. So the first mission area that we're going to talk about tonight is workforce development. And as you know, about half of our funding portfolio is allocated towards programs that support the expansion of the rheumatology workforce. And as the rheumatology workforce increases, we hope that it will ultimately lead to outcomes such as decreased patient wait times to see a rheumatologist, and also hopefully broaden geographic distribution of providers. And all of this is going to have a direct and positive impact on patient access to care. So over the next few slides, we're really going to dive into why patient access to care is immediate and a significant need. I kind of want to start off just talking about what we know to be true. So first, we know that at least for the foreseeable future, the demand for rheumatology services is going to increase due to the aging population. We also know that it's imperative to take aggressive measures to increase the number of future rheumatologists. And finally, we know that it's likely that this demand isn't going to be met just by increasing the number of rheumatologists alone. So we're going to dig into some background data that supports all of these facts now. So this first graphic represents arthritis prevalence projections through the year 2030, and they show a substantial average increase of about 34% in all states. 10 of the states are anticipated to have increases that are between 50 and 90%, and 3 of the states, which are Arizona, Florida, and Nevada, are projected to see their numbers and arthritis prevalence more than double. Similar increases are projected for arthritis attributable attributable activity limitations. So those are really activities of daily living like grasping small objects, climbing flights of stairs, stooping and bending down. And the biggest projected increases here are expected to occur in the Sun Belt along the South and also in the Western states. These projections are really showing us the need for wider dissemination of existing evidence-based interventions and also dissemination of strategies that have been shown to decrease pain and also increase function. This next graphic represents a study that the ACR's Committee on Training and Workforce did back in 2010. They conducted an analysis of the ACR membership database to help map out the per capita density of rheumatologists throughout the United States. And as you might expect, the analysis showed that the distribution of practicing rheumatologists is extremely unbalanced in the country. You can see that there's areas of high concentration of rheumatologists, specifically if you look in the Northeast, which compares pretty starkly with other areas of the country where there's low or even no concentration of practicing rheumatologists, such as the Midwest. This graphic is from an article that was featured in the December 2013 issue of Arthritis and Rheumatism. It offered a lot of analysis into not only the distribution of rheumatology practices, but also looked at a lot of factors associated with that distribution. So boiling the article down, in short, the authors found that the greatest number of rheumatologists were more likely to practice in areas with higher population densities and higher median incomes. In addition, which isn't surprising, rheumatologists are also found in areas where there's rheumatology training programs. So after talking a little bit about the need, we can talk about how to address the need. And I kind of wanted to start with just a little bit of a rheumatology career pathway 101 and talk about some interesting facts to look at as we kind of progress through the career pathway. So we know that the average medical student is graduating around age 28, and upon graduation they already have $166,000 in average in student loan debt. From there, they're going on to their residency program, so internal medicine and pediatrics residency for another 3 years, and at that point they can choose to further specialize by choosing a subspecialty. This puts them around the age of 32 when they're starting their fellowship training, and they complete that training somewhere around the age of 35 and 36. I just wanted to note that during this time, people that are pursuing becoming an academic researcher, in addition to their training, are also spending a great deal of time really looking for a great mentor, starting to perform research and publish, and also writing grants to fund a faculty salary. Moving on to early career, we know at this point the protected time really is the most important way to exceed in research, so this is going to take some additional time publishing and grant writing. I'm not sure if you guys saw, and we would be happy to share, but last year the Early Career Investigator Subcommittee of the ACR, which is a subcommittee of the Committee on Research, published an article in Arthritis Care and Research where they looked at the barriers and facilitators of a career in academics. And the biggest barriers that they found that kind of steered people away from a career in academics were lack of quality mentorship and funding. Moving on to middle career, this is normally the time that people are starting to submit applications for their first NIH R01 award, which is an independent research award. And the average age for obtaining your first R01 has steadily been increasing over the last 5 to 10 years. So right now the average age of first R01 for MDs is right around 45. It's 44 for an MD PhD and right around 42 for someone that has their PhD. And then finally, just to look at established careers. So once you've achieved a career of independence as a researcher, it really is critical to provide mentorship to help kind of foster insight, identify needed knowledge, and expand opportunities to help early career investigators. Next, I wanted to talk a little bit in regards about who is coming up through the rheumatology pipeline. So this map is something that I actually stole directly from the ACR's website. It's an interactive map on the website that shows the U.S. distribution of all of the ACGME accredited rheumatology training programs. It shows both adult programs as well as pediatric. And as of 2016, there's 148 programs nationwide. There's 112 adult rheumatology programs and 36 pediatric programs. So here is a little bit more information in regards to our adult rheumatology programs. You can see that the number of programs has increased slowly over the last 5 years, and that's represented by the green bar and the graph. You can also see that the slots aren't being filled to capacity and that there is a gap between available slots and filled slots. That's indicated by the blue and the red lines. And the last data points collected, 2014 and 2015 for the academic year, there was a total of 468 positions and 442 of those were filled for adult rheumatology programs. Next, just a little bit about pediatric rheumatology programs. You can see that the number of programs here is also continuing to increase steadily. Upon the beginning of this collection, there was 26 programs back in 2006 and 34 captured in the last year of data here. In this same time frame, the number of available positions has increased significantly as well, from 74 to 129. Looking here, you can see that there is still a large number of positions that are going unfilled, but if we look at it optimistically, the total position fill rate has increased by right around 11.5%. In terms of fellow graduates, we've consistently stayed at 232 total graduates for the last 2 academic years. You can see that there has been a small bit of fluctuation in terms of graduates over time, but on the reflected time span, we've increased from 126 to 232, which is really fantastic. Next, I want to address the health professional workforce and their potential impact in rheumatology. And this wasn't something that was super easy to measure, so we've taken a stab at it. We have about 1,300 members in the Association of Rheumatology Health Professionals, and out of membership, about 36% of them are nurse practitioners and physician assistants. We know that nurse practitioners see a range of 8 to 15 patients a day, and physician assistants see a range of 15 to 24 per day. We have a retrospective review of the nation's VA system that was recently published that demonstrated significant improvements in primary care access when utilizing nurse practitioners and PAs. And finally, employment is projected to grow in both fields, 31% and 38% respectively by the year 2022. So all these data really do demonstrate the potential impact of nurse practitioners and physician assistants, the impact that they could have on workforce and access to rheumatology patients, or access to care for rheumatology patients. Next, I wanted to talk a little bit about the ACR's workforce study. We're currently finishing up that workforce study. It's been a huge undertaking of the Committee on Training and Workforce that began in February of last year. As part of the process, there's been a significant amount of data collection. I hope I'm covering all points of data collection, but it included things like an environmental scan, a survey of multiple different stakeholder groups, focus groups, a SWOT analysis, a gap analysis, and a supply and demand analysis. So a final report on that workforce study is being prepared now, and it's going to be presented to this group in an educational webinar similar to this later on this year. The report's really going to give us a better understanding of supply and demand, and it also represents the most comprehensive study to date evaluating the practice of rheumatology in the United States. So moving forward, the workforce development goals in our new strategic plan include increasing both the availability and accessibility of healthcare professionals, also increasing the value of rheumatologic care and patient interactions. So based on this, we're hoping to see some tangible outcomes, including increasing the number of healthcare professionals choosing to pursue careers in rheumatology, increasing specialized education and training opportunities for healthcare professionals, also broadening the geographic distribution of providers, decreasing patient wait times and time to diagnosis, and also exploring new models for effective care delivery. When looking at workforce development and also increasing patient access to care, I feel like our organization has a really firm foundation to build on as we move forward in implementing the new strategic plan. So this is just a really brief representation of what we're doing now. Of course, we have solid partnerships with both the ACR and the ARHP. One thing that is kind of recent development is that we've taken over the management of the Choose Rheumatology campaign, and we have a lot of exciting plans to expand on that. We do a really good job and provide a lot of meaningful opportunities for students to learn more and engage in rheumatology through our annual meeting awards, and especially through our student and resident outreach experience, which is a 2-year-old program. We have a lot of opportunities for training and specialized education through things like our Fellowship Training Award, our Clinician Scholar Educator Award. We also have a Health Professional Online Education Grant and a Pediatric Visiting Professorship Program, and offering opportunities for mentorship through activities like the Joint Investigator Meeting and Rheumatology Research Workshop. So future plans of addressing this are included in Priority 1 of our new strategic plan, which is expanding the rheumatology workforce. Some strategies under Goal A include utilizing the ACR workforce study to determine the needs to be addressed. We also want to continue to increase engagement within the rheumatology and medical communities. We hope to support postgraduate training for physician assistants and nurse practitioners, and also increase the number of Foundation Fellowship Training Awards annually. Some of the strategies under Goal B include supporting health services research and care redesign, as well as supporting research into care delivery mechanisms, technology applications, and financial models. We also want to work to facilitate sharing and distribution of resources that have been developed as a result of foundation funding. You're going to see some details surrounding these strategies in a timeline at the upcoming April meeting, but I do want to point out that we already have some good momentum going. So some of the things that we've been doing so far, as you heard at the January meeting, is adjusting the awards and grants timeline to better accommodate the match. And as recently as this week, we've reintroduced the Lauren Daltroy Award, which aims to improve patient-clinician interactions, and that's targeted at health professionals. So kind of shifting focus over to our innovative research goal of the strategic plan. Through our innovative research program, we really do aim to increase the number of investigators that are taking important risks that might help find the next big breakthrough. We've also, up until now, increased scientific output into specific diseases, and now with the broadening of our scope and funding, we'll increase scientific output across all rheumatic diseases. Ultimately, all of this is paving the way for future treatments and cures, which in turn is really going to help patients live longer, healthier lives. So over the next few slides, we're going to really dive into this mission area. And I want to start off again with what we know to be true. So we know that discoveries that have been made possible through the NIH and private foundations have led to extraordinary improvements in the lives of patients living with rheumatic disease. On the other hand, we also know that there's a funding crisis for rheumatology research and training. And finally, we know that there's increasing pressure to demonstrate the value of healthcare delivery and also reduce waste and cut costs. So we're going to dig a little bit deeper into some of the background information that supports all of these facts. First, I want to take a quick look at the pathway to independence for rheumatology investigators, and this is pretty reflective of a typical trajectory. So that FNT is activity codes for NIH awards that support fellowship training. Next, you would progress on to a K award, which is a career development research award, and that's typically a mentored award. And then finally, you would move on to an R award, which supports independent research. And as I mentioned when we were looking at the career pathway earlier, the receipt of an R01 is really a career milestone, and it's becoming more and more that maintenance of funding at the R01 level really is essential for investigators to maintain careers in academic research. So over the next couple of slides, we're going to look at data that's pulled from the Foundation's annual funding report. And this is a report that's drafted every spring. I apologize, we're updating the data right now, and you guys are going to see a comprehensive updated version of this data either at the April or August board meeting. But what we do with this is we pull information on all the awards of the NIH funded and private foundations funded for the year, and we compare it to the ACR membership database in order to determine what types of funding ACR members are receiving. And kind of just to help a little bit with interpretation of the next few slides there's a little bit of lingo. So anywhere where you see ACR members, that data is going to be reflective of someone who's an actual dues-paying member of the ACR. Anywhere where you see ACR Contacts, it's going to include all of the dues-paying members of the ACR, but it's also going to include just other people that are in our membership database. More than likely, these are people that are participating in ACR educational programming. So it's a little bit more of a comprehensive view whenever you see ACR Contacts. As you can see here, we're looking at the different types of awards that were awarded to ACR Contacts from the NIH. And as you can see, there's a decline in almost every single type of award over the last 5 years. And most notably, and maybe most concerning, is the decline in research awards, which is reflected in the darker gold bar in the middle. And just a side note, as we look at these next few slides, 2010 does include funding from the American Recovery and Reinvestment Act. So first, taking a look at K08 awards. Again, these are career development research awards. They're mentored. Specifically, the K08 is experience and it's funding research in biomedical or behavioral research, and this also includes translational research. So the next three slides are set up the same. The first two bars at the top that are blue, you can see the total number of applications that were submitted across all of NIH over the 5 years. The light blue bar is reflective of all the applications that have been funded annually across all of NIH. And then at the bottom, you can see the number of ACR members and ACR member contacts that received that specific type of award. So you can see over the past 5 years, we've had a decline from 23 K08 awards down to 15 K08 awards. Next, looking at K23 awards, again, these are mentored career development awards, and these specifically support individuals that are conducting patient-oriented research. And again, you can see at the top the number of applications submitted annually across all of NIH, the number that were funded, and then the number that's going to ACR members and contacts. This one has seen a little bit of a decline, but less of a decline than the K08 awards. And then finally, probably the one that's the most disheartening is looking at the R01 equivalent award. So this includes the R01, but also the R37 award. The R37 is long-term grant support for investigators who have demonstrated research competence and productivity throughout their career and are likely to continue to perform in an outstanding manner. So really to highlight on this slide is that there's been just under a 48% decrease in the last 5 years of ACR members receiving these R01s. And like I said a few slides before, receipt and maintenance of this is really essential to maintain a career in academic research. So this is definitely a major concern that we're going to continue to monitor annually and hopefully even explore this a little bit more in future funding reports. The funding report that we do also includes private foundation funding. So this is a cumulative look at the number of awards and amount that has been granted out over the last 5 years. So in total, these 11 organizations have funded 684 awards. Those went to 570 unique investigators, and our total investment into rheumatology research was just over $140 million. And this just combines all the data that we looked at into one nice view of collective impact. So this includes federal data as well as private funding data, and the 5-year cumulative total being invested into rheumatology research is just under $4.3 billion. So for our innovative research goals moving forward, we really want to support a research portfolio that leads to improved treatments and cures for rheumatic disease, enabling patients to live longer and healthier lives. And the way that we want to do that is by funding the best science by the most promising investigators in the field, really continuing to encourage innovation, broadening the scope to fund research into all rheumatic diseases. And those are things that we've been doing, but we also want to build on those and explore new research directions in rheumatology. So specifically looking at things that, projects that demonstrate and improve the value of rheumatologic care, and also just expanding the overall impact of rheumatology nationwide. And ways that we're currently addressing this, first, our amazing group of investigators who are pictured at the bottom. We have our annual investigators meeting that really facilitates a lot of knowledge sharing, and also is a time where people find potential collaborations for the future. You guys heard in January about our support of the NIH Accelerating Medicines Partnership. We have a lot of strong relationships with external organizations through things like our Partners in Rheumatology Leadership Summit that we started last year, and we'll host our second one this coming up June. We're also members of the NIAMS Coalition, and then, of course, continuing monitoring of the funding climate. In our future plans to address this goal, we're obviously going to continue to build on our current successful innovative research program, but also begin to expand into these new research areas that demonstrate or improve value of rheumatologic care, and also expand the impact of rheumatology. And some of the strategies, and this is by no means a comprehensive list of the strategies that support this goal, but some of the things we want to do is really specifically highlight the desired submission of proposals with the goal of projects that support value-based care. We want to work on facilitating access to clinical research resources, and that could be facilitating access to data in the ACR RISE registry. It could also be access to practice management data. We also want to support training of investigators in bioinformatics and the use of other novel scientific and analytic approaches. And again, this is something that we've started to get a little bit of momentum and traction on. We've added the addition of health services research into our next cycle of RFAs. We've also added a project narrative to all the applications across the entire funding portfolio, really asking people to connect their projects to the foundation mission, and part of that is asking them how they demonstrate or improve on value of care. And just a couple final thoughts, and then I'm very happy to answer any questions. I want to start this part off again with the facts that we know. So our fearless leader, Dr. Madison, kicked off our January board meeting by really sharing his personal vision for the foundation's future. And he shared this quote that I thought really resonated well when he said that the innovation and research of today is the rheumatology practice of tomorrow. And I do think that we're about to embark on a really new and exciting time in the life of the foundation. I think that the strategic plan is really setting us up to be at a place where we're going to be able to see real and tangible impacts in the life of our patients, both in terms of accessing care and future treatments and cures. And then the future plans to address this and how we're going to get it done is just as simple as what's written here. So we're going to continue doing what we've been doing well. We're really going to start branching out and exploring these new research directions, and then we hope to create some really meaningful partnerships. In April, Mary's going to share with you guys a draft of a plan that we've come up with to really figure out how to operationalize our new strategic plan and turn it into a reality. So we're excited to share that with everyone in April. And with that, I'm happy to take some questions.
Well, Erin, thanks very much for a really superb overview of where we've been, what our needs are, and where we're going. And I think, especially concentrating on the where we're going, the strategic plan is really novel for the foundation. The need for the foundation's work has never been clearer, and the need for the support for the Foundation's work hasn't ever been bigger either. And so a lot of the initiatives that we're going to undertake will be, I think, very gratifying to our members and our researchers. And we as a foundation, and I think as a board, will really want to focus on creating the resources to make that happen. So that's going to be a major, or is a major direction for us to build on the development process that has been put in place over the last year or two, and to seek out more funder, donor, and philanthropic opportunities. So thanks very much for this.
Thank you, Aaron. I think that this was a superb and inspiring presentation. I do want to emphasize what you said about training all rheumatologists for the future, because I think one of the things that we need to constantly emphasize when we are doing fundraising is that we are not supporting just the academic research, just the academic enterprise of rheumatology. This is especially important to emphasize with our ACR members. We are certainly supporting investigators and the future of rheumatology research, but we want to make sure that we get back to the workforce, the compelling argument of workforce, because the academic medical centers train all rheumatologists, whether they're in practice in rural areas or in academic medical centers. So that's just something that I'm glad you brought out so beautifully, and we have the data, so we should feature that prominently as we move forward. Thank you.
Yeah, absolutely, and I'm hoping that as we get this new workforce study data out, that we can really dig into that and kind of figure out where we need to go in the future. But right now, the statistic that we know is it's a split of about 70-40, 70%, 70-30, I'm so sorry. About 70% are going into clinical practice, and the remaining 30 are going into academics.
Yes, thank you.
Thank you,
Aaron. I'd just like to thank you for all your hard work. This is very helpful and informative.
Aaron, this is Vikas, and thank you for a wonderful presentation. And I think the issue of workforce shortage has been very well documented, and you highlighted it very well. And I like that you have taken both approaches of the rheumatologist and then rheumatology health professionals, and where we likely what is current data and where we're likely to get up to. And then I think for all of us, one of the concerning thing which I'm looking at was that we have plateaued right at about 232 graduates, and we need to be thinking about ways to increasing that. And I don't necessarily have a light bulb going off in my brain, but certainly something to think about.
Yeah, this is Anne. Aaron, that was a wonderful presentation, as everybody has said. And getting to the workforce issue, I agree. It's a little bit disheartening to see that widening gap between available positions and filled positions. So you can support positions, but if they aren't filled, it doesn't really matter. And I know that division directors have actually recently sent out a survey exploring what different departments do in terms of interaction with medical students and trying to attract them to the field. I think that the kind of the portfolio of grants that we give to medical students and residents, correct me if I'm wrong, has been relatively the same for a number of years. And one area to strategize in is just how to target medical students and residents through RRF grants a little bit better, a little bit more. One of the thoughts I had was kind of targeting MD PhDs if we're anxious to both encourage more people to go into rheumatology generally, but also to attract kind of the best and brightest to maybe doing maybe doing research down the line, that might be a subpopulation that we could create special programs for and bring them to the meeting, et cetera. So that might be an area to kind of build on our portfolio.
Absolutely, and I do not want to steal Lou's thunder, but that is actually an initiative that the Committee on Research has been really focusing in on and may potentially be bringing a mechanism to the Foundation Board next January to present.
That's great.
Any other questions? Well, thank you guys so much for your time. Before you go, I want to give a huge thank you to everyone that sent in names for people to serve on our Health Services Research Study section. After the last board meeting, we got several emails, and we've been able to fill that study section out pretty well. We have a chair and our first member, so thank you guys so much for your suggestions. And then just to wrap this specific call up, I believe Heather is going to follow up with everyone tomorrow with a quick evaluation just so we can get feedback and really make sure that we tailor these educational webinars to exactly the format that you guys want and the needs that you have. So just make sure you fill that out and look for that in your email tomorrow. And I think we're getting out of here pretty early, but thank you guys so much for your time tonight.
Thank you.
Thanks, Erin.
Thank you. Yeah,
Thank you.
Bye.
Thank you.
Bye-bye.
Bye.